It's almost like we pulled our foot off the pedal.
Public health officials have warned for years that measles, a disease once eradicated in the United States, is coming back. Well, just this year, more than 1,200 cases have been reported in the United States.
Harris County has 4 cases so far, and according to health officials, none of the patients were fully vaccinated. That's the focus of a cross-country investigation by ABC investigative reporters, including our own 13 Investigates team. Tonight, reporter Ted Oberg uncovers the numbers the state won't show you and goes inside the fight to keep measles from spreading.
After 4 years of not fighting a single Harris County measles case, 4 popped up in 2019, and that has public health experts nervous.
That is, to me, the concern. It's the tipping point, right?
To keep it from tipping further, Anna Zengina and her team of disease detective epidemiologists are on the front line of stopping the spread. At first word of a confirmed measles case, Zengina and her team drop everything.
We speak with the infected individual. We get all of the places that they visited during their infectious period.
All of them, coworkers, friends, family, classmates, babysitters, random kids on the playground. If the patient visited a doctor's office, they track down all the patients who were there hours after.
All of the different rooms that the infected individual may have visited up to 2 hours after the patient left.
Every one of them is questioned about their measles vaccine status and gets a warning about what to watch for.
Each folder represents a case.
By the time the team was done with each of this year's cases, they'd called 100 people who may have come in contact with each of the measles patients.
It is a scary phone call to receive.
A full 2-shot set of measles vaccines is 97% effective in preventing the disease. But state statistics show more and more Texas school children don't have it. Almost all states allow religious exemptions, but in Texas and 14 other states, parents can opt their children out of vaccines for widely interpreted reasons of conscience. No doctor's sign-off is needed, just a parent's signature on a state-supplied form.
I think it's too easy across the country, but Texas definitely.
Since 2012, the number of students opting out has doubled statewide, but it's hard to know where those students are. The state only requires school districts to report a district-wide vaccination rate, not each campus, and for Dr. Shaw, that's not enough.
It's not about that specific district, it's about the specific school.
Texas lawmakers tried twice in the last 2 sessions to force districts to report campus-level data. Those efforts failed. So we did it. Using open records law, 13 Investigates has mapped measles vaccine rates at hundreds of school campuses in the Houston area, making it easy for you to find out what's happening where your child spends their day.
I think what it's going to do is start to raise the awareness that, wait a minute, it's not everything is fine. And I think that's where a lot of us are as Texans, is that we assume everything is okay.
Experts will tell you anything about 95% or more in a vaccination rate is okay. That's what your kids need to be safe, but which schools fall below that? The state of Texas won't tell you, but we will. At abc13.com/TED right now, you'll find a map with all of the Houston area schools, but it's probably easier just to put your school's name in that search box and search it. You can find this year's measles vaccination rate right there. If you find something that concerns you, speak up. It's your kid's health. Ted Oberg, ABC 13 Eyewitness News.